This presentation will outline specific health issues and their effects and the health needs for the Indigenous population. As Indigenous people were the first on habitable land in which we stand on today, I would like to pay my respect to the past, present and emerging leaders of the Indigenous community and thank them for the land we stand on today. More specifically, this presentation will focus on the Wiradjuri youth, which is currently the largest Aboriginal group located in central New South Wales. The health needs of Indigenous population include access to health facilities, education and mental health services. Life expectancy for Indigenous people are at an all-time low, as in 2017 it was recorded at 71.6 compared to non-Indigenous Australians at 80.6. Burden of disease is a major contributor to the low levels of life expectancy, as 90% of deaths are attributed to cardiovascular diseases and 14% due to self-inflicted injuries. Mental health is a serious issue amongst Indigenous populations, as they are twice more likely to be hospitalised as a result compared to non-Indigenous. Moreover, substance abuse is on the rise, as in 2012 to 2013, 22% of Indigenous people aged 15 and over reported using an illicit substance. Moreover, not only does mental health increase illicit drug use, it can also lead to domestic violence incidents, crime, and a breakdown of family relationships. The colonisation of Indigenous land from Western countries has had a massive impact, as westernised views was implemented upon Indigenous people from removing children, economic marginalisation, bureaucratic surveillance, prohibition of native cults and practices, and forced schooling. Our program aims specifically to help the Wiradjuri people struggling with mental health issues through a community-based program around educating and promoting awareness through sport. This specialised program can also be changed and adapted in relation to the Ghanaian youth values and beliefs. The poor health standards of Indigenous communities today can be traced back to Australia's historical background and their management of the Indigenous communities. Colonisation has affected the Indigenous population greatly, as it has resulted in a poor socio-economic status. This is the case as when Britain claimed to colonise Indigenous land, they called it terra nullius, which in turn means nobody's land. This had a great effect, as this practice of colonisation targeted Aboriginal people in a deliberate and calculated manner, basically aimed at trying to distance the Aboriginal people away from their land and resources. Moreover, colonisation also introduced many health risk behaviours such as smoking, nutrition, alcohol and drugs. As a result, colonisation forced these behaviours upon the Indigenous, in which they are still suffering from today. The Stolen Generation is one of the most horrific events that has ever happened within Australia. This caused Indigenous families significant damage, as it left a legacy of intergenerational trauma, high levels of mental illnesses, substance abuse and parenting difficulties. Indigenous communities are still experiencing grief and loss from recent events such as the Stolen Generation and colonisation. As a result, Indigenous people lost their sense of identification due to the separation from their culture and their land. Due to the loss of identity and culture, it significantly disadvantaged our Indigenous population. This not only affects employment rates, education and access to facilities, but has heavily affected rates of mental illnesses in the youth, as over 20% of Aboriginal kids are diagnosed with mental health issues. Despite attempts by the government to improve Indigenous health, more must be done to ensure the health and the well-being of Indigenous people improve.
Wiradjuri youth are part of the community of Indigenous people that experience many obstacles accessing mainstream health services in Australia, with cultural and social determinants of health factoring largely into this issue. The communication gap between health professionals and Indigenous peoples has significantly impacted their health outcomes. Miscommunication can present negative impacts on health service access for Indigenous Australians. Listening is an important aspect of communication for both health professionals and Indigenous Australians. Explaining information through communication can be timely because of any linguistic and/or differences, understanding of what the information means that has been shared. In Australia, there requires a greater recognition for improving cultural safety for Indigenous peoples, which allows health assessors to assist in improving access and quality to healthcare received. Disparities in healthcare access can be impacted by factors such as rural and remote living, financial access and well-being, as well as cultural safety. Discrimination and racism can be seen as significant factors preventing access and the quality of healthcare services for Indigenous Australians. Discrimination can create negative impacts on health and well-being of individuals, and clear evidence highlights that this is an immediate cause of health inequities amongst Australians. This can also create a consequential restraint to the development of improving health outcomes for Indigenous people and further assist in the decline of Indigenous Australian mental and physical outcomes. Limited access to healthcare services is the result of socioeconomic status, environmental and living status, employment and education, Accessing healthcare services becomes much more challenging for Indigenous Australians living in rural remote areas. In 2015, rates of disease burden in rural remote areas were 1.4 times greater than the rates in major cities with better access to healthcare services. Indigenous peoples are more likely to access health services when professionals communicate effectively, have knowledge of underlying issues, and an understanding of Indigenous culture. The cause of mental health issues in Indigenous communities need to be effectively noticed in the development of health responses and treatments. Mental health is an issue that continues to impact the well-being of Wiradjuri and Ghanaian youth. Both youth groups experience racism and discrimination, which can negatively impact their mental health and well-being. In 2011, suicide was the leading contributor to the burden of disease for Indigenous youth aged between 10 and 24. The years 2018 and 2019, rates of intentional self-harm, hospitalisation were high in Indigenous peoples. Indigenous youth aged 15 and 17 contributed to 94.4% of suicidal deaths. Indigenous youth face multiple difficulties which contribute to the continuing stresses and present negative impacts on their mental health and well-being. Linguistic barriers in healthcare services contribute to the challenges for Indigenous peoples when accessing healthcare. Both youth groups have barriers to effective and unbiased healthcare, and the services provided contribute to the linguistic differences in healthcare between professional and client. If the health professional promoting the healthcare service lacks linguistic and cultural skills, the quality of care is compromised, and the results in the health outcomes for both population groups are worsened. Ghanaian youth from low socioeconomic environments were reported to more than likely feel a sense of loneliness, stress, and suicidal ideation, which contributes to poorer health outcomes and mental and physical well-being. 62% of Ghanaian youth had reported moderate to high common mental illness. Parent styles can also contribute to the mental illnesses in young individuals, including depression. Quality of housing and neighbourhood condition disadvantage both, which have a direct negative impact on youth mental health. This includes overcrowding, family and household stability, as well as employment and financial status. Imperative comprehension difficulties can occur due to cultural differences that impact communication for both Indigenous people who speak English as a first language. The lack of prevalent language between health professional and client can result in negative repercussion on the quality of care. Between the two population groups, there is contributing evidence that effective health access to healthcare services is pivotal for greater health outcomes without facing difficulties.
To meet the specific needs of the Wiradjuri youth, it is vital that the delivery of the healthcare system is culturally appropriate, which ensures that it recognises the social, political, and economic factors that affect health. It is vital when working with the Aboriginal youth in healthcare, getting to know and understand the person's context and history is important to ensure positive health outcomes. Moreover, a recent study by Wilson showed that by including Aboriginal expertise within an intervention, it is beneficial as it helps build relationships. As a result, during the intervention, my role would be vital in running and supporting the Wiradjuri youth while also participating in the activities. Moreover, specifically when running the sporting activities, it is important that I relinquish control to the youth by providing them with choices and options of what sports they want to participate in. Most importantly, understanding Aboriginal history and their culture is very important when working with them. It is something I would research and educate myself on to ensure the health intervention is a holistic approach. In relation to the Ghanaian youth, the program must change to ensure it is culturally appropriate and respects their dignity, privacy, and safety. As English is their second language for most of the Ghanaian youth, a handbook that contains simple English terms will be provided where they will be able to learn and gain confidence in communication. Moreover, and most importantly, it is vital that I educate myself on the unique cultural needs of the Ghanaian youth to ensure I make the right decisions for the youth and it's in their best interest. Overall, Ghanaian youth suicide rates are at an all-time high. As a result, this program is vital as it will support the youth and educate them. However, it is vital to understand that the Ghanaian youth culture to ensure we can provide a holistic approach.
Promoting mental health throughout educational environments as a health professional is important to assist in providing students and/or young individuals with the skills and confidence to seek help for early intervention, develop protective factors for mental health, and grow social interactions with others, and this is crucial for the mental fitness program. It is important that providing programs such as the mental fitness program for both students and young individuals who do not have the access to educational environments develop safe and inclusive learning environments. The skills required as a physical education teacher include having the knowledge, understanding, and respect of Indigenous culture. The promotion of mental health awareness can positively influence mental health understanding and provide young individuals with a safe and engaging environment. It's important in my role as a PE teacher to be culturally aware and appropriate with the skills delivered, as well as building safe relationships with Wurundjeri and Ghanaian youth.
Individuals with mental health conditions tend to have a higher rate of foot complications than the general population. A study was conducted to assess foot care of individuals that have a mental illness compared to the general population. It was found that the individuals with mental health disorders tended to have more podiatric complications, such as foot pain, which is 48%, nail problems, which is 32%, corns and calluses at 28%, and infections within the foot at 28%. In contrast to the 5.2% for nail issues, corns and calluses reported to be 5.6% in the population and 5.1% for foot infections. This was surveyed by the NHIS. This could be due to several factors such as adequate self-care, appropriate footwear, hygiene, and consultation with a podiatrist. People with cognitive disabilities find it difficult to access the appropriate medical services within the medical sector. They may also encounter a health condition who is not aware of the culture as well as uncomfortable with a specific population group, and this can consequently lead to inadequate care. The skills needed to deal with this problem includes being aware of what the Indigenous population has been through and their long history, and being empathetic towards them. Hiring a clinician from the same culture will improve trust between the patient and the clinician, as well as improve the care that they receive. Improve health literacy, particularly in diabetes, as it is a dangerous illness that has long-standing complications and impacts millions around the world, affecting all organs in the body, particularly their feet. And Indigenous teenagers are 18 times more likely of receiving type 2 diabetes mellitus than their non-Indigenous counterparts, due to the urbanization and lifestyle changes impacting their living situation, the diet, lack of physical activity, and obesity. Finally, informing the patient on the chronic disability management plan, which gives 5 free visits to a podiatrist annually if they are eligible, as well as community health center. The mental fitness program is advocated for Wurundjeri youth, both who are and aren't in school. This program begins in week 3 of the school term, giving 2 weeks for it to be promoted and around the community, and allows individuals to enter the program. The mental fitness program will run 2 days out of the week for 2 hours at a local community hall with health professionals. This includes physical education teachers, podiatrists, and Indigenous community leaders. 1 hour will be allocated for theory, with presentations presented by PE teachers and Indigenous community leaders, and discussions on mental health between professionals and Wurundjeri youth, discussing how to develop protective factors as well as strategies to help improve the health and well-being of Indigenous youth, and creating relationships with students that foster inclusion, respect, and safety. The other hour will be allocated to physical activity and individuals engaging and socializing with other participants. The holistic approach of the program, which involves engagement of both mental and physical activity, aims to support the whole individual and flourish both sides of the well-being. Moreover, this can be applied to the Ghanaian youth when they experience inclusiveness and disregard for bigotry, which can lead to an improvement in self-esteem, mental health, and suicide rates. Ghanaian youth have differing traumatic experiences that influence their mental well-being. This includes their cultural heritage, racism, and discrimination, parental influences, and family and socioeconomic circumstances. For the mental fitness program adapted for the Ghanaian youth, discussion points and information shared would need to be altered to be related to the experience of this group. The approach of this program should be opted for Ghanaian youth, advocating better health outcomes, educational access, and environments to be safe and effective building relationships. Thank you for listening.